seniors, teachers, mentors, all of you here. Professor B Hanumaiah, I know all of you know about him because we have Oration, we have CSCP in his name, and he actually born and brought up in a village background, then moved to the city Mysore Medical School and got his first rank in Mysore Medical School. Then he moved to UK, got his surgical education, got his FRCS, came back to India, and also he was professor at Mysore and also Bangalore Medical College, and he was awarded many of the awards like Rajyotsava Award, IMA Doctors Award, and one of the roads in Bangalore, that is the 4th main road, Sudhashivanagar, is named after Professor Hanumaiah. But what I want you to reflect on is why we remember him still today and his contributions. That is, he was a wonderful teacher and an excellent surgeon. He led an impactful life and left behind a big legacy. Kindness and relationships, achievements and contributions, what we talked about, and advocacy, because an ethics, values and positive changes, and mentoring, dedication, punctuality, excellence, all these things make us to remember him every year and again. His legacy stands before us. Professor K.V. Ashok Kumar, Dr. Ramdev, so many of his students have contributing so much so the society and students. So dear friends, I am really honored and I think it's a good tribute to Professor B Hanumaiah to talk about every surgeon is a wonderful teacher. And I am very grateful to Surgical Society of Bangalore and the city chapter of ASI for giving me this opportunity. Surgeon as a teacher, mentor or educator, this role is often underplayed or not appreciated at all. Surgeon teaches without any formal training and without extra remuneration or expectation. He does it effortlessly with dedication, and he shapes the next generation of healthcare providers, and his role is very essential in society and nation building. So I wish that all of you appreciate this role so that the talk on every surgeon is a wonderful teacher. Friends, the first medical college in India was the Calcutta Medical College, which was inaugurated on 28 Jan 1835, and now it's called Medical College, Kolkata. After this, many medical colleges have come. Before this also, we had a vibrant medical profession in our country. Actually, the period between 600 BC to 200 AD was known as the golden era of Indian medical profession. We had great teachers like Sushruta and great surgeons. Foreign students used to come and study in our universities like Banaras and Takshila, and the surgeons were contributing heavily for the societal upliftment and education and the health of the society. Unfortunately, there was a dull period after that, but even during that time, the doctors were not left as they are. They were scrutinized. They were a vital part of the vibrant society. Sometimes like this, Vaidyaraja Namastubhyam Yamaraja Sahodara Yamastu Harati Pranam Vaidyo Pranam Dhananija. Means Yamaraja was better than doctors because doctors take away not only life, even money also. So such was the scrutiny by the society on the doctors. Now also we are criticized many times attacked, but this is there all the time and in all the countries also. Now we have about 766 medical colleges in India, maybe more. Also, there are about 1,20,000 medical seats, PG seats 73,000 plus, and Master of Surgery MS seats 13,649. This is approximately, I'm sure every new medical colleges, some more seats will be opened up, joined together, and the surgeons in India is around 1,32,000. We have members of the Association of Surgeons of India. Friends, all these surgeons, they do an immense service by teaching and also bringing up the next generation of surgeons. Actually, the teaching is part of a surgical training culture in our country and other places also. As postgraduates, we teach junior PGs, interns, medical students, and other people also. And after we pass out in the PHC or the government hospitals, nursing homes, private hospitals, we continue teaching and educating others. Knowledge is power, as Dr. Jaka told, and sharing it empowers not only the teacher, student, and also the public also. Now we have DNB program in almost most of the major hospitals, government, and also the private sector. There are actually about 450 plus accredited institutions in India producing more than 11,445 students of DNB doctorate, that is surgical. And with all this, the gap between the undergraduate and the postgraduates has come down quite a bit, as Dr. Sharan Patil was telling. So there is a good chance of every MBBS student getting a postgraduate seat and maybe the super specialty seats also in the future. Most of the surgeons do their teaching in the operation theatre, not only outside, and the best period they get out of their busy schedule is in the OTs. They catch hold of the medical or the surgical PGs, undergraduate, nurses, students, and the best surgeons are those who can teach others. The research has shown that the intraoperative teaching process is actually can be structured as the pre-operative briefing, intraoperative teaching, and also post-operative debriefing. This BIT method is the most effective to teach in the operation theatre before, during, and after operation process. But this is a delicate balance. Every surgeon has to do it while do not harm the patient but train the student. Safety and well-being needs of a patient and the educational and training needs of a student, the surgeon has to balance, especially so in the private sector where the patient pays for every surgery and also his treatment. So as the surgeons move on in their life, they learn this balancing act and do without harming any patient and train the students. But it's not as difficult as the reaching the peak of the Kilimanjaro or so. Anybody and every surgeon does these things very carefully. Peri-operative teaching is always going on. Prior to surgery, we counsel the patient, the relatives teach the undergraduates or the postgraduates, communicate. That is the mantra of every surgeon. Surgeon, as a wonderful educator in the public, never misses an opportunity to educate. So this voice is not coming. Okay, he is educating the patient or the relatives how to do exercise, how much to walk, all these things. So public education program by surgeons of our own association, they have done a wonderful job in the Gokhale Institute of Public Health. We are all part of it, and such programs educating the public actually does wonders. It bridges the gap between the surgeon and the public, the litigation, the attacks on surgical community or the medical community, all these can come down. So friends, every surgeon is a wonderful teacher, and even if it's one student, one resident or one patient, please teach and continue this. So what makes a surgeon a wonderful teacher? So this is, we compare to all other specialities, the surgeon's teaching comes as a second nature. They are sharing always, and the sharing is caring. Whether they are training their students, or they educating colleagues, or doing a dressing or a small operation, they are always teaching by their informal and experiential learning. Every surgeon has a teacher in him, and the lifelong learning and teaching, whether we're doing open surgery, then laparoscopy, then robotics, then now the artificial intelligence. So surgeons have to keep learning, and it is a real-time learning a lot of the time. So there is, surgeons' mistakes cannot be buried. So they will be always staring with us, and documentation is another very important thing surgeons do. Participate in professional activities and important roles even in the professional bodies and societies also. So for the surgeon, decision is more important than the incision. So even at any age, the teaching and learning process continues in the surgeon's life. So they not only explain, not only demonstrate, but they are the inspirers. They inspire everybody to learn, teach, and educate. Why surgeons teach? Why surgeons should teach? I emphasize that every surgeon is a wonderful teacher, and nobody should be left behind. Everybody should teach. Teaching is a noble calling. It's a powerful learning tool also. It reinforces the core knowledge what we have. It stimulates continuous learning. It's a collaborative learning. Lot of the times we learn along with our students, and PGs also when they are presenting and we are questioning. Teaching builds clinical confidence, communication skills, and a reflective practice in our profession. Surgeons are the role models. They set examples. I think many of you have read Srimad Bhagavad Gita. Sri Krishna says, Yadyada charati shreshtaha tattad deve tarojan. That means whatever the great man does, a teacher does, and set example, the others follow it. So our students follow our steps. Similarly, I learned many things when I was in MSKCC from Bloomgard. Professor C. Vittal, my guide, Dr. M.G. Bhatt, who taught us many of the surgical skills, Professor Buchler, Dr. H. Ramesh, Dr. Adarsh Chaudhary, and my anatomy professor, Professor Kanta, all of them. And I walk standing upon the shoulders of these giants, and if I am able to stand before you and give this oration, it is because of these great teachers. Friends, teach and leave behind a powerful legacy. Teaching not only improves surgeons' skill set, clear articulation, surgical technique, communication skills, everything, and it improves definitely your standing in profession, and we see a lot of examples in our own time at present. Teaching gives you name and fame. Swadeshe pujyate raja, vidwan sarvatra pujya, means the king may be worshipped only in his territory of kingdom, but the teachers, the scholarly teachers, have no boundaries. So they are revered all over the world, and that is the importance of teaching and continue the teaching. Good surgical teachers have an aura of guru. So they have the global teaching skills and the best oratory skills. Mastery over the basic teaching competencies. So all these come only if you continue to teach and prepare yourself to teach. Teaching requires in-depth preparation. If Kalaivadi gave such a beautiful talk today on oration, I am sure for the 20 or 30 minutes talk, she has spent at least 30 hours. Crafting a 10 minutes presentation will take hours of preparation, and the research says if we have to make a good one slide, it takes 10 minutes to sometimes hours, because depending on the complexity. Such is the depth of teaching and preparation. Surgeons create lifetime memories. Definitely, but the students or their patients may not like such long incision memories. They love nowadays the robotic or the laparoscopic minimal invasive scars. Can surgeons learn how to teach? Yes, definitely surgeons can learn and also improve their teaching ability. We have so many now the methods and also programs by the universities, the MCI, National Board, associations, all of them, they encourage teachers. There are best teaching award, teacher awards, all the things encourages people to teach. In learning, you will teach, and in teaching, you will learn. So said Phil Collins. Very, very true. But if you see in the society, there are some surgeons who hesitate to teach. May not be very confident, but the time constraint some of them have in their busy practice, they not remunerative. This is another problem. So excuses. Students not interested, how can I teach? And surgeons, if they don't teach, they get outdated and their knowledge becomes expired. So they do not reflect, get stuck by the daily course. So friends, if you don't teach, you are the loser, not the student. So make up your mind and teach. The mind is the only reason for our confinement and salvation. So make up mind and teach. As Dalai Lama has put it very nicely, share your knowledge. Share your knowledge. It is a way to achieve immortality. Beautifully said, no one has ever become poor by giving, by sharing, or by teaching. So, but don't expect everything to be taught by the teacher. As we go on in life, we learn from our own intellect, from our own good peers, and also the time also, experience also teaches us. I'm not telling there are no issues or problems in the society for the teachers. They face a lot of problems, like the teacher-student ratio. Now we have the PGs, medical students, PGs intake about 118% increase last 10 years. But proportionately, the teachers have not increased. So that's why it's very important that every surgeon teaches, and shortage of staff, job security, insecurity, and politics, bureaucratic hurdles, pay scale not revised at all, DNB teachers are not paid, pension scheme not available for everybody, job satisfaction is low, and now incentives for teaching. This is one of the big problems, low motivation because of the quality of students who are coming for the medical field. So because of this, many surgeons feel burnout. So the demands of a surgeon are many. So there is teaching, there is administrative work, there is surgery, there are OPD. So we should not allow ourselves to be burnt out. So we should be develop developing some hobbies, passion, so that we are active all the time along with surgeries, and also give importance to all our fitness and the social programs. Develop some hobby, whether it is painting, sports, photography, travel, trekking, or fitness, gym, whatever it is. They all are the best antidotes for the burnout. Friends, in the olden times, especially in Europe, the surgeon's role was difficult. So they had to perform in a theatre, that's why it's called Operation Theatre. And surgeons were the actors, operation table was the central stage, and surgery was the performance, and the audience was the general public, and they used to judge us, and also what we teach and what we perform. Then we have the operation room, where the medical students, surgical trainees sit together and observe, learn from the surgeons. Even in Victoria Hospital, we used to have a theatre which was the one floor above, where students used to come and sit in the gallery while the surgeons were operating. But the today's generation is very lucky. Surgeons are now equipped with modern teaching tools and gadgets. There is everything at our fingertips. There are air-conditioned classrooms, digital blackboards, the PowerPoint presentation, videos, YouTube, and a lot of digital tools like mobile apps, surgical simulators, computer-based simulation, and we have social media, which also teaches many things individually or in the group. Friends, every one of us has been mentored by someone who came before us. So it is our turn now to mentor someone and take it forward. Senior professors like Professor Sheshadri are all sitting here. I know how dedicated teachers they were all, and we have to follow their footsteps and take it forward. So Dr. Anjanappa always tells, never stop teaching, continue, and also mentor others. Every surgeon, as a wonderful teacher, plays an indispensable role in shaping the future of medicine and our society. His legacy extends beyond his patients and students, time and space. It has a ripple effect. So when you teach, you are not only teaching, you are teaching a generation of other surgeons. Surgeon impacts countless lives through the hands of those he has trained. He leads by example, instills competence and compassion, inspires students and colleagues to continue the tradition of excellence in surgery. So I must say that there is a wonderful teacher within each one of you. Please recognize him, and also let us worship those teachers who have contributed immensely for the progress of the medical profession and training all of us and students. Thank you very much. Thanks a lot.